Good afternoon, everyone. Welcome to the live stream today. Our topic discussion for today is about surveillance definitions of LabC, BAP, SSI, CAUTI, MDRO. And the next will be your care bundles. Okay, let's start. Before we start, can you do attendance first? Just pass. Welcome, Doctor, for our lecture today and the other stuff. Okay, let's start for our surveillance definitions. And then we have key terms. Okay. Okay. Regarding our health electronic safety network, the HASAN, this is the daily task that the infection control did for the reporting. This stands for Health Electronic Surveillance Network as a web-based electronic health solutions. It is a comprehensive and flexible system that is capable of accommodating also the public health programs and integrated public health information system to better assist public health professionals in the kingdom wide. Okay, what is surveillance? This is a ongoing collection, analysis, interpretations, and disseminations of data regarding a health-related event for use in public health action to reduce the morbidity and mortality and to improve health. HAI, our healthcare-associated infections, a localized or systemic conditions resulting from adverse reactions to the presence of an infectious agent or its toxins. There must be no evidence that the infection was present or incubating at the time of admissions. The source of the infections may be endogenous or exogenous, and it happened mostly within 2 calendar days, means 48 hours, means it's 2 days after admission. And then our HAI prevention bundles is a series of interventions related to device or process care. Just sit down. When implemented together, we will achieve the significantly better outcomes that when implemented individually, and it's evidence-based best practices. Madis, can you close the door? And then device-associated infection event. It's important for us in each department. Includes the following protocol events: the CLABSI, the central line associated bloodstream infection, CAUTI acronyms, catheter-associated urinary tract infection, BAC, ventilator-associated pneumonia, surgical site infection, which is the SSI. HII prevention bundles, it's called the same. With device. With is the non-device is only the multi-drug resistant organism, which are called MDRO. Central line associated bloodstream infection, this is with device. Catheter associated urinary tract infections, bundle, and ventilator associated pneumonia, bundle, and the SSI, the surgical site infection bundle. And we will topic that each one by one. The events. Okay, in the clogs event, you have the signs and symptoms. If there is fever, 38 for adults, 38 rectal or tympanic, 37 oral or 36 axillary for babies, chills, hypotension, vomiting, and changes in the mental health. Now in BAP, ventilator-associated pneumonia event. It's the sign and symptoms diagnosed on a radiological, clinical, and with laboratory criteria. Dyspnea, fever, tachypnea, increase of purulent secretions, hemoptysis, the wrong kind, crackles, and reduced breath sounds. With next is your bronchospasm, and this is the sample one of the BAP if we have patient like this sample. By the way, after this, we have webinar. We start the webinar forum. My participants is Dr. Sana after discussion, and you can see it this in live. Miss Susan Jan from ICU and Miss J Sel from OR department. They will inform you regarding how they do their surveillance reporting and including the care bundles. Next, CAUDI event. Fever increase of 38 centigrade, urgency, frequency, dysuria, and suprapubic tenderness. Pyuria with increase 10 WBC, cubic per millimeter. Apnea, bradycardia, lethargy, or vomiting. And SSI, this is your surgical site infection event. What is surgical site infection? SSI can be defined as an infection that is present up to 30 days after a surgical procedure if no implants are placed, and up to 90 days if an implantable device was placed in the patient. This question to us in the last survey of Sibahe in the infection control. This question. Yeah, that's it. Then we have types of SSI. The superficial incisional, this references from CDCs and this one. Deep incisional, organ or body space, and there is signs and symptoms for SSI, purulent drainage, fever with 38 centigrade, then localized pain, tenderness, and abscess. Bundles. These bundles is the one we do here for reporting the cases. Example in ICU, in the ward, in the NICU, in the OR. And this all form are already distributed for them. They have availability for it. The bundles. In bundles, collapse, the central line associated blood stream infection, you must unhygiene, maximal barrier precautions, for provided cup, mask, sterile gloves, sterile gown for patient, large sterile drape, chlorhexidine skin antisepsis, and then optimal catheter site infection, and then subclavian vein for adults, femoral vein for pediatrics. Oh, they mentioned subclavian vein for adults, femoral vein for pediatrics, and umbilical vein are PICC site for neonates. The daily review of central line necessity with from removal of unnecessary lines. Yeah, and, we have Club C form, but these forms we already have your own. This one. And the BOP bundles. Elevation of the head of the bed between 30 or 45 degrees for adults. And pediatrics, it must be on 15 to 30 degree for neonates. Daily sedations, interruptions for adults only. This is important. This is your daily assessment if you have case involved in the ICU. Of readiness to extubate for all ages. Peptic ulcer disease, prophylaxis for adults and neonates only. And then deep venous thrombosis, deep venous thrombosis prophylaxis unless contraindicated for adults and neonates only. And the important one is the daily oral care. And keep the vein circuit free from condensations every 2 to 4 hours for pediatrics and neonates only. Use meticulous hand hygiene before and after contact with ventilator circuits. Change in line suction catheter. Use in ICU, atira sa. Change in line catheter system only when soiled. See, only when soiled, not necessary you will change. Or every 72 hours for pediatrics and neonates only. So, nobody here from nursery. Then store oral suction device in clean, non-sealed plastic bag when not in use for pediatrics and neonates only. Okay. Back bundles. Yeah. But then it will explain by our, for BAP is Miss Susan Jan, and for Kauti is Miss Jaisal. She will explain for it. Then for Kauti bundles, avoid unnecessary urinary catheters. Necessity of catheter insertion indications is your pre-op use. Monitor input and output. Does mean your the urinary the urine output of the patient. This is input and output. Pressure ulcer healing and others. Insert using, of course, our aseptic technique. Appropriate hand hygiene practice, then maximal barrier precautions, the gloves, drapes, and sponges. Sterile or antiseptic solutions for cleaning the urethral meatus. Single-use packet of sterile lubricant jelly for insertion. Use as small a catheter as possible. Maintain catheters based on recommended guidelines. Maintain a sterile, continuous closed drainage system. Keep catheter properly secured to prevent movement and urethral traction. Yeah. Sa atiran, it's good. Then keep collection bag below the level of the bladder at all times. This is how you carry your catheterization. And then maintain an unobstructed urine flow. Empty collection bag regularly using separate collecting container for each patient and avoid allowing the drainage spigot to touch the collecting container. Maintain method of care with routine hygiene. Then review catheter necessity daily and remove promptly. Yan. The PAU forms will be, next will be, we have our participants, Ms. Jaisel. She will explain this button. Now, remember this stats. Stats means clippers, antibiotics, temperature, sugar, and SSI bundle. Antimicrobial prophylaxis, glucose control, normothermia, and hair removal. That one. Applicable for this. And SSI bundles, appropriate hair removal, appropriate use of antibiotics. Antibiotics was given within nurses in the ward, in the ICU, in the or within 1 hour before surgical incision and 2 hours for, take note, vancomycins. Vancomycin, 2 hours. Prophylactic antibiotics are consistent with recently updated guidelines for surgical prophylaxis. Discontinuation of prophylactic antibiotics within 24 hours after surgery, except cardiovascular surgery. Prophylactic antibiotics should be discontinued within 48 hours after surgery. This is in the guidelines, proper guidelines for the safety of your patient. Then normothermia means 36.1 centigrade to 37.1 centigrade. Maintenance of post-operative glucose control means if the patient's diabetic. And cardiac patients only. Yeah. See, there is must have a serum glucose levels below 11.11 mol liter and 200 milligram per dl collected at least once at the first pause of day 1 and serum glucose day 1 at 6 a.m. and then there is serum glucose level 11.11 200 milligram per dl collected at least once on the second pause of days means how many days? Day 2. This you will follow this. This is the guideline for or diabetic patient. This is follow in all, not only here, also in other facility. And then serum gloss day 2 at 6 a.m. This particularly for diabetic patient. Then skin antisepsis, pre-op showers and surgical site preparation. And see, and there is also There is SSI. We should have bundles also. We have bundles in the SSI, and we have surveillance first form in the SSI. Okay, thank you. I will uh, uh, let you explain another one, the car bundles. Car bundles. This one's good. I mentioned I mentioned the MDRO. So for additional information for this, is for additional information for our car bundles. Yes, car bundles. When you think of bundles, what do you think about? It's a collection of things tied, tied or wrapped together. Bundles, according to the Institute of Health Improvement, group of evidence-based care components, measures when executed together might result in better outcomes than if implemented individually. It must. Why bundles are formed? To prevent what? HAI. This is your healthcare acquired infections. Yesterday, healthcare, HAI, not hospital. Working together, she told, working together. So, what are car bundles? That I told before also. Collection of interventions, measures, procedures, usually are 3 to 5 are evidence-based. It's considered evidence-based. All clinical staff know that these interventions are the best practice to prevent infection, but their application in routine care is inconsistent. A care bundle means to ensure that the application of all the intervention is consistent for all patients at all times, thereby improving outcomes, which is infection prevention. And the types of care bundles, yeah, I mentioned already this anyway. Above, yeah, this one. The catheter, associated urinary tract infections, bundle insertions. I already discussed this already. The county bundles, yes. Yeah, this one. I will the bloodstream infection, CBC bundles, and that one. Same. Hand hygiene, the maximum barrier precaution upon insertion. 2% chlorhexidine skin antisepsis. Optimal catheter site selection. Avoid what? The femoral vein for central venous access in adult patients. This one. And daily review the need for the line with prompt removal of unnecessary lines. It's applicable for both doctors and nurses. Yeah, doctor. Yeah. And then this CBC Insertion Checklist, and we have checklist of this. What is that MAR? EMR? Your electronic medical record of the patient, like in the system when you're doing the laboratory for this. Before procedure, optimal catheter type selection, appropriate site selection. Then wasn't immediately prior to procedure, handed off his her pager before the procedure. Hand washing directly observed and pre-procedure site. During procedure, wear sterile gloves during catheter insertion, and maximal barrier precaution. Maintain sterile field course, and then assisting physician follow the same precaution. All staff and patient in the room wear masks. After procedure, catheter cups placed on lumens, catheter sutured in place, then type of dressing. Sterile technique was maintained when applying dressing, dressing dated, and then hand hygiene was performed after the insertion. The CBC maintenance checklist criteria. Central venous catheter, daily review of line, of course, the necessity. CBC dressing clean, dry, and intact. Insertion site visible under transparent dressing. Transparent dressing changed within the last 7 days. Level of it. Level and document dates dressing last change. It's documentations. More on documentations. Aseptic technique followed during dressing change. Then followed aseptic technique during tubing change. Okay. I already explained this. So we proceed the MDRO. MDRO, our multi-drug resistant organism. This the one will discuss by Dr. Sana, but then on the forum, this multi-drug. I will only give some points of view. MDRO. Yes, the hand hygiene. This is your infection prevention bundle. Consists of hand hygiene, antibiotic stewardship. Inshallah, if time we have discussion for antibiotics, it will be discussed by Dr. Sana. Inshallah. And then environmental hygiene, single patient use items, patient family education, observe contact isolation precautions. Yan, that's the criteria of bundle checklist. The hand hygiene, 5 moments. O see, 5 moments. So that's why we have all poster the big 5 moments, and especially in the ICU, we have 5 moments poster for it. Compliance contact precaution, signage, signboard, the poster, our poster in the PPE, we have that complete. And then dedicated single patient use equipment. Environmental cleaning and disinfection as per hospital policy. Only essential supplies for 24 hours. Dedicated equipment inside the patient. Decolonization by use of antimicrobial soap or chlorhexidine, gluconate. Antimicrobial stewardship, careful use of antibiotics. Inform for clinical pharmacists. Patient and family education provided. Strict visitors controlled by following isolation precaution. Now Giselle is already on the backstage. And then after this is the summary. A care bundle is a simple tool used to improve reliability in care delivery. Bundles are all on and then used for different conditions and is now adapted for MOHs. Bundles are all evidence-based methods endorsed by CDC and WHO, Communicable Diseases Center, and World Health Organization. And Susan, you tell to Susan to be ready. Huh? Thank you. Okay na, it's okay na, doctor. Okay. Because now, you know this, it was on the link. Okay. That's this one. Thank you, doctor. Thank you. Okay. Thank you, doctor. You already signed, doctor, the... Okay. Okay, Giselle, are you ready for the discussion? I would like I would like to welcome you, Miss Giselle, in our uh, webinar forum discussion. She's in the backstage.
Hello.
Hello, Miss
Hello.
Giselle. Good afternoon, Miss
Good
Giselle.
afternoon.
Welcome. This is our IPC linkers and the OR department. Just
Mm.
wait a minute. I will, because Dr. Sahar is still here. I will give instruction for it. Take it again. Wait, Giselle, because just a minute, Giselle, ha? Stand by, Giselle,
Okay.
ha?
Okay.
Stand by, Giselle, ha? Because Dr. Sir is still here, so she will be at he also will be at that. Okay? Okay. Ka. Oh, Susan is come. Wait, Susan, ha? Just wait.
ما عندوش نت عايز يشير بيشير عليا. اللي ما عندوش نت عايز يشير بيشير عليا. كنت بقول لك من واحد لتسعة.
أنا عندي بس كده رصيد. الأصوات دي
من واحد لتسعة كنت بقول لك. اللي عايز يشير يشير عليا.
Okay, I will start now, huh? You see how I do the part? Ah, yes. Okay. Next will be Susan Jan. Hello, Miss Giselle. Good afternoon.
Hello. Good afternoon.
Yes, I can hear you. Now, can you please discuss to us what is your part on our surveillance and care bundle on your department as you are the representative of your department?
Okay. First of all, good afternoon, everyone. Good afternoon, AGH family. Thank you for inviting me for this webinar.
Okay.
So, by the way, my name is Lu and I'm the representative of OR department. So, I will be discussing the two forms that we are using in OR that is related to ICP or our infection control department. So first of all, I will be discussing the surveillance form. Do you have copy? Does everyone of
Yes.
you have copy of it? So the infection control surveillance form, it consists of
Mm-hmm.
um, 7 sections. So we need to fill up this one, especially first of all the surveillance date. And then on the section 1, this
Mm-hmm.
is the patient and hospital information. So we just need to fill it out. The
Mm-hmm.
patient ID, location, if the patient is admitted in the ICU or in the ward, or in OR. And also the gender of the patient, the date of birth, all basic details of the patient on the section 1. And if the patient is like newborn or infant, so we just need also to include the birth weight and also the gestational week or gestational age. Second, on the second section, the admission and diagnosis information. So we will fill up how long the patient stay in the ward or how long the patient stay in ICU. And we need to fill out the admission date, of course, the discharge date, either on the ward or in the ICU, and also the diagnosis of the patient. So on the section 3, this is already
Okay.
on the operating section or operative procedure information. If the patient undergo or had undergone operation, any surgical operation. So it is important on the form that we need to
Yes.
provide or put the name of the date of the procedure, the name of the procedure or the surgical procedure, and also the surgeon who did the procedure. And there's also a box here you need to fill up if the case is emergency or it has undergone multiple procedures. So we
Multiple
just need
procedure.
mm, yeah. So we just need to fill it out. And if multiple procedures, then we need to specify. We just need to write down any other procedure done to that patient on that day. And next, if the patient has undergone laparoscope or endoscope or any used laparoscopic instruments. And if the patient has implants and has undergone any trauma before. And we need to classify the wound class or classification of wound present on that patient. So there's a box here, clean, contaminated, dirty, or infected. So we just need to assess the wound itself and we just need to check or fill it out either of these choices. Then
The
also if
nurses. Okay,
yes.
go. Go ahead. Go.
And also on the section 3, it is included the general anesthesia if the patient has undergone general anesthesia. So you just need to check yes if the patient has undergone general anesthesia prior or in the operation or surgery. And if no, then specify what kind of anesthesia was given to the patient. And then we also need to fill out here the actual procedure duration that has done to the patient and the procedure duration cut-off point, if there's any. So on section 4, patient risk index category, we need to fill out, this is about the anesthesia. So the anesthesiologist should also check this form to fill out about the ASA score or this is about the anesthesia. And the wound class, if there's any wound present before the surgery or it's not related to the surgery but the patient has any wound. And procedure duration. So how long the procedure or the surgery has done. And next, if we produce any CS, then we just need to fill out the height, weight, and labor duration, and especially the blood loss of the patient that has undergone CS. Next, the section 5, the surgical site infection information. So,
Yes.
as what was tackled earlier, the infection, it is considered infection if it has occurred within 30 days. So we need to fill it out
Yes, the one I
if
mentioned.
if the patient has or occurred an infection within 30 days. So just fill it out on the section 5, SSI information event. And there's also other um, questions or questionnaire or algorithm here that we need to just fill out. So that's all in the section 5 SSI information. And then below is the if SSI is indicated. So that is why this is the reason of the or the purpose of this form is to detect if there is an SSI had occurred on this patient. So next is the section 6, which is laboratory record. So if necessary or there's any other actions that has to be done, so we need to collect specimen or withdraw blood or extract blood from the patient, and we need to send it to our laboratory department so that they can check further about it. And then next is lastly the section 7, which is the infection control surveillance result. So this is already managed by our ICP head or ICP department.
Yes.
So that's after we fill out everything, so we need to forward this one to our ICP so that they can check it further. And next is the
For,
SSI, the cervical site infection bundle checklist. So this is what we have in OR. Um, we have three criteria on this checklist, which is the pre-operative criteria, intra-operative criteria, and the post-op criteria. So, upon admission, actually the ward should also fill up this one because antibiotics should be given on the ward department or the uh, ward area. But in some cases, especially if there is emergency or we need to give additional antibiotics, so we need to fill up this one in the operating area or OR department, the intraoperative, which is we need to give or we need to document that we gave antibiotic in operating room department. Next is the so under this criteria, we specify what type of antibiotic given, time, and the name of procedure done to the patient. Also the incision time. Lastly, post-operative, if we still give uh, antibiotic or urgent antibiotic given to the patient post-operative. Also, the ward can also fill this out before the patient has been discharged. So all of these forms, this form, the SSI form is included or we do have a copy of this on the patient's file. And we have the record of it and we will send it or we will forward every details or every forms back to the ICP. And that's all.
oh,
Thank you.
thank you, Miss Giselle,
You're
for
welcome.
yeah, thank you for the participating for our webinar forum for today as the
Mm.
representative of your department. And
Okay.
the next will be Miss Susan Chan in our ICU. I would like to welcome you, this lady, Miss Susan Chan. Hello, Susan. Can you on, Susan? Hi, Giselle. Susan is already prepared. Hello, Susan. I'm calling your attention. Or if you're not ready, I will call Dr. Asana to be with us because she's waiting also. Susan? Hello, Susan. Good afternoon. Welcome to our webinar forum for as a representative of the ICU department. And how do you do your surveillance and your care bundle? Can you tell us for the information of other staff here? They are still here inside the lecture room. Yeah, on the mic, Susan. Your microphone. Wait, Susan. We cannot hear you because your mic. Can you on? On the mic. You'll be the one.
Yeah,
I
now
do.
you can hear me?
Yes, that's it, Susan. That's it. Now I hear
Okay,
you.
okay, okay,
But
okay.
now it's
Okay,
I
okay,
hear
okay.
you now. Now you can talk now. You start now.
Yeah, okay. Good
Good
afternoon. I am
afternoon,
Miss
Susan.
Susan John. Yeah.
Yeah.
Representing our ICU team, I would like to tell about the care bundle, about the centerline insertion.
Mm-hmm.
First, I will tell about the procedure. What are the things we will take care during the procedure? What are the checklist we have to follow?
Okay, go.
Hello. Okay,
Yes,
okay,
yes.
okay.
Go on.
Yeah. When we do the center line, we have a checklist. We have to
Mm-hmm.
follow according to the standard of CBC and our infection control. We have to write the date of insertion and the physician inserting the line and the unit department and the assisting nurse and it is the which type of line we are inserting, double line or triple line, like that.
Okay.
Hello. And
Yes, yes.
then the location. There is three areas we can insert center line. First is the subclavian. The second is the jugular line, and the third is the femoral line.
Mm-hmm.
Usually in ICU, we are preferring the jugular line. Hello.
Yes. I'm
Ah,
with you, Susan. Uh,
and then the
I'm with
femoral
you.
line. We are not
Even
usually
doctors are
preferring the
really
femoral
with
line. Yeah, femoral line because it's
you.
not the clean area, so we are preferring the subclavian area.
Mm-hmm.
And then the procedure we have to do the hand washing and before to start the procedure we have to take consent from the patient. And then we will do the hand washing and then we have to wear the PPE before start the procedure and we have to clean the area with the alcohol and then the doctor who is doing the procedure who he will do the will wear the sterile gloves and then wear cap, gown and mask and then we will doctor will insert the line and then we will cover the line with the sterile gauze and with the sterile dressing and then we will write the date of insertion and the time. And then the second thing is if the patient is admitted in the ICU for how many days, we have to follow the checklist. Like we have the checklist for the daily maintaining the regarding the type of the center line and the dressing is clean or no and the dressing is transparent or no, like that. And if the dressing is clean, if the dressing is transparent, we will not remove for 3 days. And if the dressing is soak or only we will change the dressing after 24 hours. And then the fluid that we connected to the center line, the tubings also we must put date for the tubings and if any the three-way connection, if we give any medication we have to clean with alcohol and scrub with 30 seconds. And then before doing any procedure we have also to do hand washing and the area must be sterile also. This is the checklist we have to follow. for the daily. And then after this, we have a surveillance report.
Okay, Susan, I'm
You
hearing
can
you.
hear me, Irene?
Yes, yes,
Okay,
yes. Go,
okay.
go, go.
Okay. And then from the infection control departments, we have a surveillance form, and this surveillance form is to check the patient with the central line having any infection or any organism or no. For this surveillance, we have a form. We have a form. This is the form for the
Yes,
thing you can see. This is the
yes, yes. Okay.
surveillance form from the infection control department. It also include patient ID, file number, and department, and another for the admission date and how many days patient stay in ICU, and diagnosis also. Don't forget to write the diagnosis. And then the number of center line inserted, the number of center line inserted, the how many times the doctor pricked, if only once or two times, like that, and the type of center line also. It's a single line or multiple line, like that. Then
Okay.
the laboratory, if the patient having any complaints, if the patient having any complaints like a fever, chills, or hypotension, and we will the laboratory will come take a culture swab, and then after the result of the culture swab, we will find out what organism the patient is having. Then the laboratory will record the organism, and the infection control will do the surveillance regarding the bloodstream infection. If the patient is having no fever or any infection, that means if there is no infection to the patient. Hello.
Yes, yes. I'm with you,
Yeah,
Susan.
this is
I'm,
regarding the center line. Any doubt? Anybody have any doubt? You
it's
can
okay now,
hear me,
Susan?
Irene?
Yes, yes.
Yeah, yeah.
Yes, yes.
Yeah. Anybody
You're.
have any doubt? Any doubt regarding the center line
No, 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 no.
insertion? Okay. Then I will go through the second one, ventilator associated pneumonia. That is WAP.
Yes. Okay.
If the patient is connected to mechanical ventilator, we have also a checklist, ventilator associated pneumonia. This checklist is to do to prevent the pneumonia from the patient.
Yes.
So we have also criteria for the checklist of the WAP. This also we have to the and this is the checklist for the WAP.
Yes.
Yeah, this is for the adult patient. And then the checklist also include the name of the patient, file number, and the department. And then
Okay.
the head and elevate with 30 degree. And the patient, if the patient is in the ventilator for continuous at least 7 days, we have to follow the DVT prophylaxis to prevent the thromboembolism
Mm-hmm.
and the peptic ulcer prophylaxis. And if there is any sedation giving to the patient, that also we must mention. And very important is the oral and mouth care for the patient in the ventilator. And also we have a hand washing technique before doing any procedure to the patient in the ventilator. And then we have also surveillance form to prevent the pneumonia for the ventilator patient. This is
Oh,
the surveillance form. I think
mm-hmm.
you can all see. Yeah,
Yes.
yeah. This is the surveillance form, and this also include the patient name, file number, the location, and the case of the patient. And then what admission date, and how many days the patient stay in ICU. And then the number of times ventilator use. Sometimes if the patient connected to ventilator, and if the patient is better, we will do weaning, and suddenly the patient arrest again, we will connect it to the ventilator again. That's what they mentioned, the number of times the ventilator used. And
ET tube insertion date and the removal date also you must mention in that one. And if the patient is more than 7 days in the ventilator, they will do tracheostomy for the patient. So that also you have to mention. And then if there is any, if the patient is for 7 days in the ventilator, there is also a WAP event information session. So this also they will do culture from the ventilator suction tip. If the how can we take the patient in the ventilator culture? We have to insert a suction tube and cut the tip of the suction tube in a sterile culture bottle and then send to the laboratory to find out for the organism. And then the infection control will do the surveillance, and if any organism it will they will update in the infection control department. This is regarding the work.
Okay.
They have any
Okay,
doubt or any
Susan?
question?
No, no question. The next will be Dr.
Okay, okay,
Sana.
okay.
She is now waiting
Okay,
for
thank
the
you.
discussion.
Okay.
Okay, thank you, Miss Susan.
Okay, okay, okay.
Thank you for the
Okay, thank you.
participation.
Okay, okay, okay.
Thank you. Hello, Doctora. Doctora Sana, are you there? Because you are now in the backstage. Hello, Doctora Sana. Okay, Doctora. Welcome to
Hello,
our live. Yeah,
how are
welcome to
you
our live.
doing?
Welcome. Okay, Doctora, being part of your laboratory
Good
department in our
afternoon,
surveillance.
everyone.
Yes, good afternoon. Good afternoon, Doctora. I hear you. Now, being you're the head of
Are
the.
you are you hear me?
Yes, yes, yes. Really, I am. I can hear you. I hear you. We have a good sound. We have a good sound here. Now, being part of the laboratory. Okay, and then you just discussed the MDR for a short a while because there is problem in the connection here, and that's why. Go, Doctora, for your department, what is your part in the surveillance in our facility?
Yes, in the laboratory, infection
Yes,
control
yes.
safe.
In the MDR, how do you identify our microorganism as being part of the surveillance in
Yes,
our program here, our
all
facility?
is the specimens that may be found or organism may be found in the microbiology department.
Mm-hmm.
Klebsiella E. coli, Enterobacter species, and Klebsiella also may be found.
Mm-hmm.
Um, Clostridium difficile that produce toxins not
Mm-hmm.
usually identified in the microbiology department.
Mm-hmm.
Um, Infection surveillance.
Pardon, Doctora. Go. Yes, Doctora. Go. Go. Anyway, you're in record, so that even late they can watch. They can hear you. They can. Yes, Doctora. There's a problem. The sounds. I'm still here. Okay. It's okay. By next time, we will be with us, our medical director, for a while because it's running more than two hours now, and I would like to thank you, Dr. Sana. Anyway, we will discuss on the second on next week, and with Dr. Suher because of the connection now, it's something there is a problem now. Anyway, and because you cannot hear me. Thank you for watching today, and then I will continue this on the next week for the continuation with the presence of our medical director and our head of the laboratory departments. And thank you for watching and for participating with us today in our live stream discussion. And it will continue more. Thank you.
Thank you. Welcome.